This is the program that brings you all the important information you need to know about NAFDAC. The agency is saddled with the responsibility of safeguarding our health by ensuring that the foods, drugs, cosmetics, and medical equipment made available to us are safe and wholesome. Welcome to NAFDAC and Your Health. My name is Tosin Adebayo. We kick off this week with the meeting between NAFDAC and representatives of UNITAID, a global health agency engaged in finding innovative solutions to prevent, diagnose, and treat diseases more quickly, cheaply, and effectively in low and middle income countries. Representatives of MMV, Medicines for Malaria Venture, and others. The meeting, which had the Director General of NAFDAC, Professor Mojisola Adeyeye, on seat, alongside other directors of the agency, converged to discuss collaborations to further boost Nigeria's local pharmaceutical industry across board, including the production of vaccines in Nigeria. Professor Adeyeye intimated the meeting on how far NAFDAC has come over the last 4.5 years of her leadership, leading up to NAFDAC's attainment of WHO Global Benchmarking Tool Level 3.
I will start with regulatory system strategy. And I use the analogy of a house being built. For the 4.5 years, NAFDAC has been building, and I will pick examples of what have led us to where we are right now. We are driven by local manufacturing, but the industry cannot be strong without the regulatory being strong. And if you look at what is on the wall there, NAFDAC quality policy, we started with training ourselves on quality management system. Because if you do not have a mindset to have a quality product, all efforts will be futile. So we got trained for a year and a half, January 2018 to June 2019, and it was agency-wide training. Are we there yet? No, but we are 10 times better than what we were, what we used to be 4.5 years ago. Why is that so important? Because if we don't think of the end user, which is the patient, then everything that we're doing will be for nothing. There will not be quality product that will come out at the end of the line. So if you are talking of local manufacturing of what? It has to be quality product. So that is what we started with, to change our mindset. We became standard operating procedure driven regulatory system. Why is that so important? So that with repeatability, reproducibility, we can act. And once we are able to do that, we build decision into the process, and that will translate to quality. At the same time, we started the global benchmarking process, January 16, 2018, to be specific. Because we knew that we have a steep slope to travel, but we put our minds to it. What these directors have done over the last 4.5 years is almost like a miracle, but it is hard work. It is because we started with the quality system. We need a quality system in place. At the same time, I remember about 4.5 years ago, almost 5 years now, the local manufacturers gathered their PMD man. And I told them that as a pharmacist in 1980, well, I finished 76, but 1980, going to the US, the FDA was in a bad shape. I was working in a hospital, Baptist Medical Center. Whenever missionaries are going back for follow, they buy medicines from Nigeria. And we ask why. Oh, forget FDA, America. We were good. But when I came back 37 years after, things have changed. So we made it our daily whatever that we're going to restore the dignity that was lost. We're going to make sure that our local manufacturers are capacitated. The local manufacturers are capacitated. We, of course, are capacitated to lead them. That was how we started the quality management system.
Professor Adeyeye highlighted some of the revamping that had gone on in the agency to ensure quality outcomes and drug security in Nigeria. From good manufacturing practice to pharmacovigilance and post-marketing surveillance to marketing authorization, laboratory upgrade, introduction of technology, interagency collaboration, and so on.
So a lot of things are happening, and that's evidence-based that made our 868 to disappear over 4.5 years because of the hard work and vision, ambition-driven that we have.
You must be proud of your team and yourself.
Oh, are you kidding me?
I am proud of it. Well done, really. Big congratulations.
You know, thank you. It is because of our local manufacturing that part of the reason is why we are doing it. Because if we don't have quality product, our local manufacturing will fizzle.
Vaccines are also on the front burner of the revival agenda of NAFDAC, and the country is already set on that path.
Nigeria has been manufacturing vaccines since 1924. 1924. I was shocked when I heard it because that is veterinary vaccines. I didn't know, despite the fact I'm in Nigeria, you know. On a beautiful campus in the middle part of the country. We have the ecosystem. We used to manufacture our own vaccines, yellow fever, measles, yes. We used to. Yes.
Lagos here.
In Lagos, just about 2-3 miles.
The building we were this morning.
Yeah.
Yes. That's the second building.
Oh. Yes, we used to manufacture our own vaccines, but we are starting where we left off. But the capacity is there. We went to the Veterinary Institute in Vaughan, and we just see scientists that are so capacitated in biotechnology, biochemistry, pharmacology, toxicology, and all those there. So we have the capacity for vaccine. It is that we need partners to jumpstart this for us, because COVID-19 pandemic has taught everybody a lesson that you cannot say, oh, we're going to be manufacturing in this part of the country, of the world, and that country will. No, we have to capacitate all the countries.
As with other agencies represented at the meeting, collaborations are sought to help reinvent the local pharmaceutical industry in Nigeria and achieve drug security and positive health outcomes.
As we move forward on this journey with all of our partners to support domestic manufacturing, which we think is critical, in terms of supply insecurity that the world has seen over the last 2-3 years, it's how can we as an organization play our supportive role, working in strong collaboration with partners and organizations such as NAFDAC that are critical to ensure that these projects are sustainable.
What we try to do is, when we identify relevant innovation with potential for public health impact, a better drug, a safer drug, a better diagnostic, a better prevention tool, we try to essentially ready the market for that to be picked up by organizations that will fund by national programs such as the Nigerian national program. And typically look at a number of dimensions and barriers that might get in the way of creating those conditions and try to address them. So whether it's about innovation and availability, making sure we have the right product, the right formulation. Pediatric formulation is often missing from the programs of manufacturers. We've done a lot of work in TB, in HIV, in malaria, with pediatric formulations, trying to develop formulations that are adapted. Supporting clinical trials. So when we see a gap in evidence, for instance, a drug may have been trialed in a certain population, but pregnant women maybe were not included or co-infected in the populations. And so we might support clinical trials to fill those evidence gaps and support the process of evidence generation.
We'll take a short break now. NAFDAC and your health. We'll be right back.
The MedSafety app is the latest reporting tool introduced by the National Agency for Food, Drug Administration and Control in November 2020 as part of the Innovative Medicines Initiative project. The app is made available to the public in collaboration with World Health Organization, Uppsala Monitoring Center, Medicines and Healthcare Products Regulatory Agency, UK, and National Agency for Food, Drugs and Administration and Control, NAFDAC. The MedSafety app allows users to track safety information of medicines, vaccines and other health products, report adverse drug reaction to a medicine or vaccine, and view data on suspected side effects. When you have received your COVID-19 vaccine, you can use the MedSafety app to report any adverse reaction or side effect you may feel. The app can be used by anybody, irrespective of whether you are a medical practitioner or not. You, your family and friends, everyone can download and use the MedSafety app to report adverse drug reaction. Just search for MedSafety on Google Play Store for Android and App Store for iOS. When using the app for the first time, the user needs to select his or her region. In this case, Nigeria, and also choose the preferred language of choice. The user will then be taken to the login page where you create an account by providing your email and password or proceed as a guest. To create an account, you are required to provide the following details: reporter type, example, physician or pharmacist, as well as their name and email address, password with at least 9 characters with 1 uppercase letter and a number. Read the privacy statement and accept. Once you are logged in, the user is presented with a number of tabs, which includes news, products and watch lists. Under the Report tab, the user can report a new suspected adverse drug reaction, ADR. On opening a new report, the user is prompted to input patient details, which include initials, sex, and date of birth. The user is then required to input details of the suspected medicine. These include suspected medicine name, other drug details such as strength, batch, dosage details. Multiple suspect drugs and concomitant drugs can be added at any time. The report can be saved and completed at a later time. A saved report can be found on Pending Reports and can be continued by clicking on the report and continuing from where the user stopped. Enter reaction details, reaction date and outcomes. Multiple suspects' reaction can also be added. Also, further details about the report can also be included, such as did the reaction cause prolonged hospitalization, disability, congenital anomaly, or birth defect, life-threatening results in deaths, and so on. Finally, you can also add details of any relevant medical history before submitting the report. The user receives a message on the app confirming submission and an acknowledgement in the mail for submission. Reports can be created and saved without internet connection and be sent whenever internet connection is available. The product tabs show all medicines in the NAFDAC list database. It's easier to navigate to a drug or vaccine of interest, and this data is obtained from the WHO Uppsala Monitoring Center. User can also add products of interest to their watch list to get the latest information on the drugs. All products added to the watch list can be viewed in the watch list tab. The News tab displays drug safety information by NAFDAC. This is usually up to date with drug safety information. Registered users can also edit their profile or change app settings. For more information on the app, please contact the National Pharmacovigilance Center (NPC) at NAFDAC headquarters, plot 2032, Olusegun Obasanjo Way, Wuse Zone 7, Abuja, or call 09290511110 or send email to medsafetyapp@nafdac.gov.ng or pharmacovigilance@nafdac.gov.ng.
Welcome back. If you are just joining in, you're watching NAFDAC and your health. In Abuja, a 3-day pre-survey training of field officers was held on food fortification compliance monitoring of the selected food vehicles for mandatory fortification, being anchored by the Food Safety and Applied Nutrition Directorate of the agency. NAFDAC officers from all over the country gathered for this training program, put together for the sole purpose of equipping NAFDAC field officers with the knowledge and skills required to be team leads in their respective states for the successful execution of food fortification compliance monitoring of the mandatory fortified food vehicles at the retail and market level. Now, remarks presented by the Director of Food Laboratory, Dr. Nwachukwu. The Director General stressed the importance of these mandatory fortification of food to the health of Nigerians and the crucial role the agency plays in monitoring to access and enforce compliance.
Over the years, the Nigerian government, development partners, as well as food manufacturers have deployed considerable effort to sustain the national mandatory food fortification program for the ready availability of adequately fortified foods for the population. The reason for this is not far-fetched. To contribute to improving the nutritional status of the various population groups in the country. As a national regulatory authority with a mandate for ensuring food safety and quality, NAFDAC is responsible for enforcing the food fortification regulations to ensure that selected food vehicles meet the mandatory food fortification levels in line with the set national standards. NAFDAC is a member of the National Fortification Alliance, NFA, with the Secretariat domicile in EPSAN Directorate. The assigned role of the agency within the framework of the NFA is to carry out nationwide monitoring on compliance with mandatory fortification standards by sampling and assessment of the mandatory food vehicles, flour, sugar, refined vegetable oil, and salt.
The reports of the NAFDAC's monitoring are shared with the National Fortification Alliance, NFA, to enable informed decision-making and action in improving the national nutritional indices. This has become even more imperative at this time because of the recorded decline in compliance.
The report of the 2019 market level survey of the fortification status and compliance levels of mandatory food vehicles conducted by agency in collaboration with the Global Alliance for Improved Nutrition, GAIN, showed a decline in compliance with the national fortification standards for most food vehicles. The current trend of packaging and distributing mandatory food vehicles such as vegetable oil indiscriminately without fortification is a quest to meet the market demand. In a quest to meet the market demand, may have contributed to the decline compliance with approved standards. The report of the 2020-2021 compliance monitoring exercise did not indicate any significant improvement in adequate fortification. It is therefore important to consistently carry out this compliance monitoring exercise, which is mandatory, to serve as a repository of data for the levels of fortification of mandatory food vehicles at retail level, to provide the basis for evidence-based, impactful regulatory decision-making on improving the health status of Nigerians through delivery of adequate fortified food.
A nationwide monitoring exercise will commence immediately after this training program. According to the Director, Food Safety and Applied Nutrition Directorate of NAFDAC, Dr. Edwards, the participants have been carefully selected for the task ahead.
Food fortification is an important intervention to curb micronutrient deficiencies which are rife in our population. These include deficiencies in vitamin A, in iron, in iodine, in zinc, and these are the most common around the world, also in Nigeria, particularly amongst children, pregnant women, and adolescent girls. So we have vitamin A deficiency, we have iron deficiency anemia, iodine deficiency disorder, zinc deficiency, folate deficiency anemia, that's the folic acid deficiency anemia, as examples of micronutrient deficiency diseases or disorders. Apart from these visible and serious health conditions, micronutrient deficiencies can also lead to less clinically notable reductions in one's energy levels, one's mental clarity and acuity, and just general reduced capacity to function. These are really serious consequences of micronutrient deficiencies, which can result in reduced, or shall I say, poor educational outcomes, reduced labor productivity, and increased risk of susceptibility to other diseases and health conditions. There is thus a spectrum of negative health, social, and economic consequences that stem from micronutrient deficiencies affecting the individual, the family, the society, communities, and the country. On the flip side, which is what we intend to achieve as a country, the health benefits of consuming adequately fortified foods include increased productivity, fully developed mental skills, improved maternal and child health, and improved general well-being, considering the role micronutrients play in maintaining a healthy lifestyle and a healthy life. The need for effective and efficient monitoring by NAFDAC of these selected food vehicles that should be mandatorily fortified cannot be overemphasized. And this should set the tone for this pre-survey training of a carefully selected group of officers over the 3-day period, as you are prepared for the task of going out into retail to sample the products which are offered for sale, placed in our markets for consumption by our population.
Participants took turns to get further clarifications about the process of monitoring and standard operating procedures. Here is where we draw the curtains on the program. Please join us, same time, same station, next week for a fresh edition. In the meantime, if you have comments, complaints, or you want to report activities of fake drugs or adulterated food product peddlers, our doors are always open. You can reach NAFDAC via toll-free numbers. For inquiries, call 0700 162 3322. For complaints, call 0800 162 3322. You may also email NAFDAC at nafdac.gov.ng. If you have complaints about any form of misconduct, you can reach the Reforms Unit via email reforms@nafdac.gov.ng or call the Reforms hotlines on 0909 763 0506 or 0909 763 0507. NAFDAC, customer focused, agency minded. Importing, producing, distributing, and selling fake drugs and cosmetics, adulterated food, and so on are criminal activities that destroy lives. Join the fight against these heinous crimes by reporting any suspicious activity in your area to NAFDAC. Let's join hands to safeguard the health of our nation. See you next week. Bye.